Hey, this is Nicole. I want to show you guys a pulmonary artery catheter, aka the Swan-Ganz catheter. So, all right, if we kind of move in closer, a couple things. This is usually inserted in through an introducer, and it's going to, if you can kind of imagine, it's going to sit in the pulmonary artery. And the reason we use these catheters is we want to get a cardiac output, we can get pulmonary artery pressures, we can attain a central venous pressure. There's also SVO2, so there are catheters that the tip will have a fiber optic sensor that can measure the saturation of venous oxygen in the pulmonary area right before that blood goes to the lungs to exchange O2 for CO2. So SVO2 is a great value to follow that gives you an idea of how your patient's utilizing oxygen. Now, one of the other things that's kind of cool on these catheters, so remember, this is going to sit in the right side of the heart. So there is this kind of this filament that sits in the right ventricle, and it's actually this filament that calculates the cardiac output. So remember, when you're getting a cardiac output from a pulmonary catheter, you're actually getting a right ventricular cardiac output, and that's a really important thing to understand. So if we kind of move back, so there's little markers on the catheter. So each big fat mark is 50 centimeters, and then each little mark is 10. So we can kind of zoom in here, and you can see, so for example, like this big fat one would be 50 centimeters, and then this is the little skinny one is 10, so that's a 60 centimeter position. And you always want to note when a patient has a PA catheter, how many centimeters, kind of the centimeter marking on the external part, just to give you an idea of position. Placement's usually verified by X-ray, and so ensure we've got good positioning, but also you can look at your waveforms to make sure the waveforms make sense. Some other things, so we've got a number of different little kind of ports here. So for example, this is what we call the distal port. That will be transduced and we'll get a pulmonary artery pressure. You can also kind of get a wedge on that. And then this is the central venous pressure port. So it's blue. So usually this will give you a right atrial pressure. And then this great little syringe here. So this is what a lot of you famously call getting a wedge. And we've tried to kind of get away from the term wedge because technically you're not wedging anything. A proper term is pulmonary artery occlusive pressure. But what I want you to see, so imagine again, this is sitting, so this is kind of getting clumsy here, sorry about that, but this sits in the pulmonary artery. So when we inflate the balloon, so kind of watch the balloon inflation here. So when you inflate the balloon, what that does is it blocks out pressure behind the balloon and only looks forward. So basically you're getting a pressure that's indicative of the left atrium. So you're getting essentially left atrial pressure reading. So pretty cool stuff. I know I feel really lucky in my career. I got to work with Dr. Ganz, who created Swan-Ganz, and he was consulting at the time in the 1990s. But honestly, it's a great catheter to use in the right patient population. So who is it mostly used in? Patients post open heart surgery, patients in cardiogenic shock, so patients where you really need cardiac output and intracardiac pressures to help guide therapy. And that's the key thing, as long as when you get these numbers, you really need to understand what to do with the numbers and to guide therapy. If that's not happening, then there's no need to have a PA catheter in patients. So pretty cool stuff, little mini lesson on the PA catheter.